veterans who are with us, so I'm really pleased with the individuals who are very focused on one thing, and that is delivering results for New Yorkers. And it was my philosophy is to really empower these cabinet leaders to use the power of their agencies to do good for people. It's that simple. It's our philosophy. And any way we can break down barriers and silos that have existed before, I'm encouraging them to have a lot of cross collaboration. So we had some really important conversations as well. We learned from each other. So we talked about not just our immediate recovery from the pandemic, which we'll give you the update on in a couple of minutes, but also just what is the long-term prognosis as we emerge from this pandemic. And I talked about in our State of the State, this new era for New York. And I wanted to hear from my cabinet members how that mantra, how that philosophy really applies in their own work every single day. So we really start out by addressing something that has always been there, has always been simmering under the surface, and that is inequities in society, racial, ethnic, geographic. And so we've talked about different agencies and their responsibilities, but also through the lens of addressing inequalities. And we talked about, first of all, we heard from Brian Benjamin, our Lieutenant Governor, and he has really seized the opportunity to talk about gun violence and how we can doing so much more to address this issue. He is my representative on our interstate gun task force, gun interdiction task force. We're working for the first time ever with 9 adjoining states and the NYPD as well as the Boston PD to have a strategic approach that addresses the influx of illegal guns coming into our state. So I thank him for that. He also talked about his role in dealing with NYCHA. Again, NYCHA, public housing in New York City, is one of those areas that's sometimes too hot to handle. It's controversial, but that's why I gave it to Lieutenant Governor, because he has a depth of experience and understands the needs of the community. So I wanted to empower him to focus on the issues there as well as having him focus on, as I did as Lieutenant Governor, the Regional Economic Development Councils, which is really where all the action happens. That's where the communities have a chance to define their own destiny and to focus on projects that'll right the wrongs of the past and sometimes connect communities that were divided by infrastructure or a lack of access to waterfront and incubator space and downtown breweries and all the exciting things that can happen in vital downtown. So I want to thank him for working on that as well. But then we also listened to our other leaders, and I raised the question about, as we're coming through the pandemic and the inequities are still so prevalent, how do we address them? I mean, not just talking about them, but how do we get our arms around it and actually do something? So someone whose counsel I've relied on from the very beginning since she ascended to become our Commissioner of Health, Dr. Mary Bassett, spoke about how we have to talk about how we can eradicate those inequities by quantifying them and addressing them with a very strategic approach to that as well. So we talked about that. Also, Adrian Harris, an individual who's really stepped up as our Superintendent of Financial Services, talking about areas where we can even address something like a freeze to have on check cashing fees that were automatically expected to increase, and because of steps that she's taking in a thoughtful way, realizing this is not the time to increase fees on people. They're dealing with the coming through a pandemic, but also inflation is sucking up so much of our income these days. So she's just putting a whole different approach on what she does and bringing more transparency to the work of the Financial Services Department. And Dr. Anne Marie Sullivan, who literally has gone down to see individuals who are homeless in our communities, has talking about a different approach to addressing their very real needs and how we can help them get the services that they need to have through a whole spectrum of opportunities, but also the fact that 40 to 50% of all New Yorkers have had some impact from the pandemic on their own mental health, and particularly for our children. So she's done a lot of on that front. We also talked about bringing out our other partners here, our other cabinet members, how we prepare for the workforce of tomorrow in light of what we just came through with the pandemic. And Commissioner Reardon did an extraordinary job issuing, what's the number again? It was off the charts. Tell the benefits.
Over $104 billion to 4.8 million New Yorkers.
$104 billion in unemployment benefits, and that's how much, under normal circumstances, we would allocate in a 50-year period. 50 years. We did it in 2 years. That is extraordinary. So we talked about that, but also what do we do now? How do we realize there are people who fell between the cracks or whose job was automated out of existence? How we get them into the workforce training that has to occur for us to emerge out of this stronger than ever before. So she talked about the career centers we have, partnering with SUNY and CUNY, and also the fact that by no longer requiring that financial assistance is available for part-time students, how transformative that simple change can be for individuals to have access to education. Hope Knight, our president and CEO of Empire State Development Corporation, she talked about how we build up our pipeline to talent, because when we're recruiting businesses to come to our state, and I spend a lot of my time doing just that, the first question is, tell me about the talent pool. Tell me where I'm going to get the workers with the skills I need. So we're really taking a different approach, integrating Department of Labor's talents with Empire State Development, because they know, even before the deal is signed, what businesses would come here if they had the right talent and how we can address those needs in a preemptive way, a proactive way. So she spoke about that. Basil Sagos talked about the unique opportunities we have as we continue to position New York State as a true leader in fighting climate change and creating green jobs, what those jobs look like, how we get people to train in those areas, so again, we can be ready and poised for the opportunities of the future. So he talked about how the Environmental Bond Act itself, $4 billion we proposed, that'll result in 84,000 jobs right there alone. And these are jobs to make sure that we have healthy drinking water and systems to make sure that we're resilient as well for the next major climate events. And also our offshore wind. What great possibilities we have with offshore wind. I was out there last week on Long Island announcing our first major wind farm. The rest of the world is watching what we're doing here in the state of New York, and it's a very exciting time for us. And also, lastly, I asked our cabinet members who are dealing with the whole specter of gun violence. And this is top of mind for most New Yorkers right now, and how it really, we went from being a very safe state to having a real problem with gun violence. But we're not alone, and that's an important point to make well known, is that the entire country is dealing with an increase in gun violence. But that doesn't mean we're not going to tackle this. You know, we can, while rates are going up all across the country, why can't New York State be one of the first that takes strong steps to eradicate this and make sure all New Yorkers feel safe? And so we talked to Superintendent of State Police Kevin Bruin, who talked about how we can use, and we're putting many more resources, you know, funding for more positions, and to put people into areas we hadn't needed to before, monitoring social media, finding out what individual gang members are talking about, or threats, or in one, you know, social media post showing a new gun they purchased. That's not legal. That gives an opportunity for us to interdict guns before they're used in a crime. Also, Rosanna Rosado, our former Secretary of State, now our Commissioner of the Department of Criminal Justice Services, talked about how we have to, within that system, have implicit bias training for people to realize how they're approaching their responsibilities as part of our criminal justice system, and how we can take steps to increase fairness in everything we do. So I wanted to make sure we had her voice in this conversation as well. And then Jan Oliver, who is often, I talk about, we see him with shovels and plans and all sorts of new ideas and how we're going to expand our subway services. But he also is responsible for, you know, making sure people feel safe on the subways. We're seeing very good metrics right now. We're almost back to pre-Omicron numbers, which is great. Before Omicron, we were at about 60% of our normal activity on the trains and subways. Then we dropped significantly when Omicron hit us hard, but now we're almost back to where we had been pre-Omicron, and eventually we'll get to the old pre-pandemic levels, so we're very excited about that. But what else are we seeing in the subways? This is a place where there have been heinous acts of crime, and that the homeless have been finding that that's where they're congregating and living, and that's not a place that they need to be. They should be. They need to get services. They need direct interventions. So we talked about how we're going to have teams. We announced this with Mayor Adams last month, and we had to put out RFPs and get the people hired and get them out there. And we'll be out there very shortly talking about exactly what they're doing and their responsibility to make sure that anyone who takes the subway feels very safe and secure. These are all elements toward our comeback. getting people back to their jobs, making people feel safe in the streets, feeling safe in our public transportation, and making sure that there are jobs for them to come to. So this is a very thoughtful conversation. I'm proud of everybody, and it's a dynamic team. These are the most dedicated public servants ever congregated in one administration, and we worked very hard to make sure that we had diversity and representation from all voices, all walks of life, and all racial and ethnic communities, and I'm proud of that. And I was very proud to see all of them in person for the first time as their governor. So before we take questions, I do want to talk for a couple minutes about where we are with COVID, since we're making great progress. How about this? We are at pre-surge levels. Our average cases are now, average case indicators are now at pre-surge levels, the lowest since October 25th. You saw our spike January 7th with 90,132 cases. That is a 97% drop just since January 7th. This is only February. I mean, that is an amazing drop. I don't think we could have foreseen that. We prayed for it. We hoped it would happen, and it actually did happen. So to everybody who followed our guidelines, the businesses who complied with what we asked them to do, the people who got vaccinated and got boosted, and people who wore their mask when the numbers were that dangerously high, we have the lowest case rate of any major state, any large state in America. So that's something that didn't happen because we wanted to. That was as a direct result of strategic policies that we've been announcing throughout the fall and continuing with our winter surge plans. So we're also #1 in large states in terms of testing. We're proud of that. And we're continuing to distribute over 34 million test kits already out there. And we're going to have 92 million in the hands of our New Yorkers in the next few weeks. So 7-day average is down. Our positivity rate, 3.27. And our peak was at 23%. Hospitalizations, look at that, 72% drop in hospitalizations over the last month. That is such a relief for all the healthcare workers who've just been working so hard, showing up day after day, absolutely exhausted. I could see it in their eyes, and they still showed up. And so we're still so proud of everything they've done for nearly 2 years now. But this is also good news for all of them and for the people. Despite the fact that we're seeing decrease in hospitalization, we still lost 66 New Yorkers yesterday, and we look forward to the day when that is a 0 in front of that indicator. That'll mean we've really come out of this. So major progress here. I just want everybody to see that hospitalizations are down, not just statewide, but across all regions. You saw a little while ago, we saw the decrease in the major areas like in downstate, but upstate was still trending upwards when it came to hospitalizations. And now every part of our state, all 10 regions are finally going down, and new COVID admissions are down as well. So making great progress. You can see what we're doing here. Western New York down 21%, North Country down 27%. Our hospitalizations are declining. Also, we had a number of hospitals who are on our executive order list. These are people, entities who had to suspend their elective surgeries because they didn't have enough capacity. Remember, we talked about any hospital that falls below 10%. We need to make sure that they are ready to be able to take any influx of patients. And we did see a huge influx of patients just in the short time from the end of November to the end of December. And part of our preparation was to say suspend elective surgeries, make sure you have the capacity to handle it, and that's exactly what happened. So now we went from 23 recently to having only 5, and they're all concentrated in the Finger Lakes. We're working closely with those hospital systems. Vaccinations. We're making progress. Our 5 to 11-year-olds have gone up dramatically. We can do better, but look at that. That is a great trend, nice trend line there. And we are #1. Again, I love looking at New York State being #1 among large states in several metrics. One is with the total population with at least 1 dose. We are #1 among large states with the age 18 up and up fully vaccinated, as well as 12 to 17 fully vaccinated. So we're excited about this. These are good numbers. We're heading into the midwinter break for students, and we've already sent out over 5 million test kits for the students. So parents know that when their kids come home for that break, they have a test kit, test them, then Monday before they head back to school, make sure they're negative, test again in a couple days, and then as I mentioned, we'll be having to take a look at that Friday, March 4th, on what the numbers are, looking at all the variables I've already outlined, so we're really excited about that. We're also continuing to focus on vaccinations for kids with 29 new pop-up sites. adding up to over 222 pop-up vaccination sites. So also making sure that we have treatments available to us. I was just on a White House call a couple hours ago and talking about how we're going to be very aggressive in the distribution of this at the federal level, but certainly when the federal supply is allocated, that we're very early in line in terms of getting these doses of antiviral and monoclonal antibody treatments, making sure that if someone does get sick, that they contact their healthcare provider, particularly if they're over 65, that they're a little more vulnerable. We want to make sure they are safe. So that is the good news. New Yorkers, you have a dynamic, incredible cabinet, which we just heard from. We also have some very, very promising numbers on COVID. So we are in a good place today. Karen?
I wanted to ask you about the Democratic convention that's coming up a little later this week. You seem to be in a good position. You're far ahead of your challengers. Wondering if you feel like there's things you need to do, or are you going to relax, enjoy the ride? What your thoughts are going in?
Karen, I'm a Buffalo Bills fan. I always have an underdog mentality, okay? Because you never know if there's going to be 13 seconds when you wish something else had happened. So that's my approach to life. That is my approach to all 13 elections I've been in. I run like an underdog until it's over. So I will continue focusing on delivering our message to New Yorkers, how we're fighting for them, how we have strong policies that result in social justice initiatives, which are important, but also help people get jobs, help them get to this pandemic. So we have a lot of priorities. So we're going to continue speaking to New Yorkers. That is basically the strategy. Continue speaking to New Yorkers and let them know what our administration has been accomplishing. Dan?
Governor, a few weeks ago, a wage board recommended that farm workers now earn overtime at 40 hours instead of 60 hours over the next 10 years to phase in. I'm wondering if you're going to accept that recommendation, and the Commissioner of Labor is here too, if you want to answer as well.
We still have time to have that under consideration. Again, the way I operate, I solicit opinions. I want to hear from a lot of voices. I actually had a very productive meeting with representatives of the agricultural community, the Farm Bureau, and we talked about where they are in terms of their needs, and there are many areas where we should be hitting this. One is that the federal government needs to step up and do what I asked them to do a decade ago when I was in Congress, and to free up more visas so they can get the temporary guest workers, and not just during the growing season or the planting to harvest, but also year-round for our dairy farmers. So I would love to see more workers in place, first of all. But with respect to the specific question, we are looking at it closely, but we are also looking at a way, if this is going to be the case, it'd be a long rollout, plenty of time for people to adapt to it, but also understand that this is something, agriculture, this is an essential industry for us. I mean, we talk about the essential workers. If we don't have this industry strong and viable, then the food banks that I visit down in the Bronx and in Queens and in Brooklyn, I just was a few weeks ago, they don't have the food through our nutrition programs that we ship down from our farmers. It's grown right here. We need to keep that lifeline open, as well as what they do for our schools and for our restaurants. So I understand the whole dynamic. I represent a very rural area with many farmers and dairy farmers in Congress. So we want to get it right for them as well, and make sure that we take care of our workers, give them what they need, but also give the farmers perhaps tax relief to help ameliorate the impacts. But it is not final, but we're getting close. Yes?
You have received more money from limited liability companies than any other 2022 candidate. In over 130 of these cases, your campaign did not record the LLC's owners in violation of a 2019 state law. Your campaign declined to comment when asked about this by New York Focus and the city. Why is your campaign not reporting this, and how does this comport with your vow to make Albany more transparent and ethical?
Well, we certainly are continuing to follow the law, and the law requires these individuals to provide us with the information. So this is something that we are focusing on, trying to get all that data collected from the LLCs. They need to provide this information to us, and we'll continue to follow the letter of the law, make sure that every bit of information that is required to be reported is reported. I believe in this. I believe in these laws. They're important. They're important reforms, and my team will continue to make sure that the information is available as soon as we get it, as soon as we're able to get it from the individuals who've made those contributions.
From people who don't proactively provide this information, and there's a difference between the letter of the law and what you said about making Albany especially transparent and ethical. Right?
No, we're continuing to get this information, and we'll make it available when we have it.
You recently reiterated your support for having workers return to the workplace, but there are many workers out there who are enjoying the convenience of remote work, and they would say, the economy is still humming here. So I'm curious why you support, why you think it's so important to have workers return to the physical workplace, and what you would say to those workers who enjoy the convenience.
Well, first of all, we're talking about specific geographic areas. When I made that statement, it was in New York City. New York City is the economic engine for the entire state of New York. Our budget is healthy when New York City does well and people are working in the city. So we want to make sure that people are getting back, taking the subways, which is why I'm focusing on subway safety, making sure that the culturals are vibrant and Broadway and the restaurants and the hotels are all active. What we're seeing is fascinating, and Jan Oliver just spoke about this, that we're seeing off-peak activity go way off the charts in terms of ridership, meaning people will come into the city for entertainment at night, or they'll go to performances or arts and culture, see their friends on a weekend, but they still won't go into the office. So they're out there. And just to get our community back in a place where we're still having those creative connections. I can't tell you how many business leaders, and whether it's a law firm or it's a financial service institution, whether it's a tech startup, what I don't want this young generation to miss, or this generation that's enjoying the experience, is the opportunity to evolve in their profession and to do better with mentorships and those relationships. So that, for me, is a lost art if people are isolated in their homes. But that being said, I also need this whole economy to come back. And particularly New York City has to be the vibrant place it was with people on the streets. It also becomes a safer environment when you don't have abandoned streets. The buildings are filling up, the subways are active. All of this has to come back again. Now, different parts of our state have a different experience. It may make sense for someone who has a long commute in the North Country to continue commuting remotely. So I was speaking to the New York City experience, to business leaders, and what it's going to take to bring back the New York City Midtown in particular economy.
We have time for one more.
Governor, on masks in schools, Dr. Bassett mentioned last week at a FIPIC meeting that there's no cut line that you're looking for in terms of a threshold of numbers, but you are looking at a lot of data. Is there any vaccination rate or any other data points that you're specifically hoping to see at a certain level when kids come back to school on March 4th, whether it be 50% vaccination rate among kids? Are there any numbers that you can give folks who are looking for a goal, like passing a test?
I'm glad to have the opportunity to explain this, because there is a thought that this is a strategy that's going to be involved in looking at a specific number and saying, aha, we hit it, it's time to go back, or time to take the masks off. But I have to point out why that would be filled with shortcomings, that approach. What we were looking at this past fall was a decline in numbers. By mid-November, we could have said, the numbers are starting to feel, let's say the number is going to be, 3%. Within a very short time, we were at 23%. And I know that parents and school districts and superintendents, they want some certainty. They want to know the lay of the land. So we can't be doing this up and down effect of diminishing their confidence in all of us and in our system. So what I want to do is look at the variables I've laid out all along. I will look at vaccination rates. And as you saw today, they are going up. When they were in the 20s, that was not sufficient. But there's not a magic number. I know the numbers are trending upward, and that is positive. I'm also going to look at what our infection rate is at that time, because I could throw out a number. I could say it's 3%, 4%. What if we never get to that number? If I say it's 2%? I don't want a specter where kids are going off to college wearing a mask because we came up with a number and we never met that number. We don't know. All we know is the numbers are trending downward in the right direction. And you combine that with infection rates, with a decline in hospitalizations, that has been very important to me. And also examining what pediatric hospitalizations are looking at that time. In December and early January, that was the headline news, the number of children being hospitalized. But now we have more kids being vaccinated. So it really is a holistic approach to it. But lastly, I'm going to tell you what I'm looking at as well. I'm looking at global trends, because November 26th was the first day that Omicron was even named as a variant. You saw what happened quickly in South Africa. It went from non-existent to off the charts. Same thing in England. If I start seeing trends that there's another variant out there, and I pray there's not, and we don't see that. I ask Dr. Bassett all the time, don't see any variants yet. I was just on my White House call, no variants yet. But I also have to reserve the right to make the decision that's going to affect thousands of children, millions of children in the state. I have to base it on the most current information. That'll literally be the days before we do it. So for me to telegraph now, or even I've been asked for months to give the numbers, and I think everyone sees now, in hindsight, we would have been so wrong. If we had said back in November, let's take them off, we're fine now. We were not fine. This was still an ongoing, dangerous pandemic. So I feel confident with the trends we're seeing, what we're experiencing, the knowledge base we've amassing, the experts we're talking to, that by that date we'll have a good snapshot. Are the numbers continue to decline? Is the rest of the world stabilized? Do we have enough hospital capacity, and what's the infection rate in the area? I believe that that'll give us the best indicator at that moment, is at the time to lift them. I know everybody wants an answer. They want it nice and clean. They want to say, we're going to hit that, but it's a combination of factors, and I can't ignore that. All right, thank you, everybody.